How old does a kid or teen in Canada have to be to get prescribed gender-affirming hormone replacement therapy? This is Xtra Explains HRT for young people. When we're talking about trans folks, HRT, or hormone replacement therapy, is the use of hormone medications to treat gender dysphoria and achieve the desired physical and emotional changes that align with one's gender identity. And HRT can be a key part of healthcare for many trans people and alleviate dysphoria by making our flesh-prisoned bodies a little bit more comfortable to live in. And trans adults' use of HRT is more widely understood by the public, but there's a lot of confusion and misinformation about HRT for younger trans people. Many opponents of gender-affirming care for young people like to shout about the irreversible changes, claiming that these medications are being prescribed way too young. But here's the truth. While some of these medications can cause certain permanent changes, such as body hair growth from testosterone HRT or breast development from estrogen, getting access to them is such a rigorous process, it makes getting into university look easy. Young people who want HRT must meet extensive requirements and go through consultations just to start. In Canada, accessing gender-affirming hormones for young people is very strict. Most young people wait more than a year before getting the medication. And when you're a teenager where your body is changing without your control or consent anyways, that wait could feel like an eternity. The Canadian Pediatric Society says that starting doses for hormones in adolescents are typically way lower than in adults, with doses being dialed up slowly over time to simulate natural puberty. A teenager isn't getting like a boatload of hormones that aren't appropriate for their age. In Canada, accessing gender-affirming HRT varies from province to province, but according to standards set out by the Canadian Pediatric Society, in young people it usually requires a diagnosis of gender dysphoria or gender incongruence, plus a demonstration of the capacity to understand and appreciate both the benefits and risks of these medications. And again, that can take years to get when you factor in various diagnoses and results. The process of starting to access gender-affirming hormones can happen as early as a young person's mid to late teens, but it's different for everybody based on their circumstance. And the goal of getting on gender-affirming HRT as a teen is all about making your life easier. In addition to alleviating dysphoria and helping young people socially transition, early access to HRT can limit the need for more invasive surgeries or treatments later in life. So next time you hear someone going on and on about kids getting rushed into taking hormones, make sure that you have the facts. And head to our profile and xtramagazine.com for more explainers on topics like kids in sports, surgery, and puberty blockers.